Hi Mona, my name is Henna and I'll be your student physical therapist today. Today we're going to be going through a series of assessments just to assess your risk for falls. So the first thing that I did was put a gait belt on the patient. This is just to make sure that if there's any unsteadiness that you can be there to protect them. So the first test that we're going to do is called the chair stand test. And all I'm going to have you do, I'm going to time you for 30 seconds and I want you to cross your arms. So this is just eliminating the use of the upper extremity. So we're testing the endurance and the strength of the lower musculature to get in and out of a chair. And so I'm going to time you for 30 seconds. I just want you to stand up and sit back down as many times as you can. If you get tired, you can take a break and just rest, but try to go as many times as you can. All right, ready, set, go. And stop. Okay, so I counted 14 for Mona, and the normative values are based on gender and age. So this is typically assessed in older individuals, which Mona doesn't fall into any of the categories, but one of the categories would be age 60 to 64. For females would be getting less than 12 would indicate a risk of falls, and I counted 14 for her, so she's good there. And then the next assessment, I've put a marker here 10 feet away from your chair. So all we're going to do is stand up from the chair, walk to the marker, and then come back down, or come back and sit down. And I'm going to time how long that takes you. And I'll walk with you just to make sure that in case that you have any unsteadiness. All right, ready, set, go. Good. And she took 9 seconds to perform this. Anything over 12 seconds would indicate a risk of falls. All right, so the last test we're going to do is a series of 4 steps. So I'll have you stand up from the chair. The first part is just with your feet slightly together. I'm going to have you hold this position for 10 seconds. So now we're just looking at balance, which is also an important indicator for falls. Okay, good. The next part of the assessment is similar to a half tandem stance. So what I'll have you do is just put one foot halfway in front of the other. Good. And hold this position for 10 seconds. Good. We can move on and do a full tandem stance, so one foot in front of the other. And then the last progression will be to just stand on one leg. 10 seconds. Good. So if she were unable to do the tandem stance or the two previous positions, that would indicate a risk for fall. And good. All right, you can sit back down. So these are just a series of tests that we would use to get a baseline of our patient's balance and strength. I would typically choose these assessments for an older individual who may be at risk for falls, or for an individual who had a procedure or surgery that may put them at risk for falls.